It's Thursday, December 17th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. My guest this week is Dr. Kitaw Demissie of Downstate Health Sciences University School of Public Health. He's going to be speaking with me about the recent release of the COVID-19 vaccine and the latest on the COVID-19 pandemic. The COVID-19 pandemic recently hit a major milestone with the first vaccines being administered in the nation to frontline healthcare workers. In New York, the first vaccine was administered to a nurse from Long Island Jewish Medical Center. As many hope the vaccine will bring the world closer to the end of the COVID-19 pandemic, there are several concerns over its safety. One of the chief concerns are its side effects. Many African Americans have said they will not take the vaccine despite officials saying it's safe. And Dr. Demissie is on the phone with me right now to discuss the COVID-19 vaccine and the latest on the pandemic. Welcome to the podcast, Dr. Demissie. How are you?
Good, Josh. Good talking to you today.
All right. Well, thank you so much for coming on. Well, you and I have been talking about COVID since the beginning. First, thank you so much for all the service that you're doing. We have to thank our healthcare workers and our doctors and our nurses. So first, thank you. And I also want to thank you for, guiding us through the year with COVID-19. But now we're at a very pivotal milestone in the pandemic, and that is the vaccine. And there are so many mixed things that are going on with it, from side effects to, a lot of people saying they might not take it, to people who are advocating very hard to take it. First, tell us a little bit about the COVID vaccine and what exactly it does.
Thank you for inviting me first. So the COVID vaccine, the advantage is it prevents actually from people having a very strong COVID infection, and at the same time, it prevents, even if they have it, it will be a very mild COVID that they will have. But the main thing is prevention of symptomatic or clinically relevant COVID infection is what it does. It prevents from that to occur. It doesn't mean that people will not get the virus, but the vaccine will prevent the occurrence of clinically relevant COVID-19 infection. So people will not be sick with COVID and will not be hospitalized and will not die if they get the vaccine. That's the advantage of the vaccine.
Okay. And a lot of people have been seeing it on the news. Can you go into a little detail about how it works exactly? I know there has to be 2 shots. Is that right? You have to get two injections. Is that right?
Yes. So the way it works is the COVID-19, the name COVID, coronavirus, is because of the structure, like a crown structure, and it has spikes, and there are proteins on that spike. And the coronavirus vaccine now is working against those spike proteins, and the messenger RNA, which is a nucleic material of the virus, encoding that spike proteins will be coated with a lipid and introduced into the individual's body by injection, and that will help our body to create immunity to destroy the virus or the cells that contain the virus. So, number one, the virus will not be able to get into the cells if you have the vaccine. And the second thing is, even if it gets into the cells, the virus will be destroyed by our own immune system, humoral immune system, that will destroy the cell that contains the virus. The virus is given in 2 shots. The first shot will be given. Then if it is a Pfizer virus, you have to take another shot 21 days later. If it is a Moderna virus, you have to take the second shot 28 days later. That's how it is given.
Okay. And I just want to go over how effective it is because, we're still in the middle of this pandemic, as we're going to talk about in a little later. When you get the first shot, let me ask this. I'm sorry. Let me re-ask the question. when you get the second shot, how long will it take for you to become protected from COVID-19? Because you get the first shot, then you get the second one. How long is the period before you are just fully protected from the virus?
Yeah, usually it takes, the system, our body actually should create the antibody. So at least you need to have about 7 days before it's completely effective. But the trials are showing 7 days after the second dose, then the protection is here. But even before taking the second dose, after taking the first dose, there is a huge level of protection from, getting clinically relevant COVID-19. So, but, after you get the second shot, definitely 7 days later, there is a huge protection. The efficacy of the Pfizer virus is 95%, and the Moderna vaccine is about 94.5%. In other words, among 22,000 patients who took the Pfizer virus, only 8 people developed coronavirus, and among 21,000 patients who didn't take the coronavirus, the Pfizer virus, or who took the placebo, only about 162 subjects actually developed the disease. And when we talk about the Moderna virus, among 15,000 individuals who took the vaccine, only 5 people developed the COVID-19, and among 15,000 individuals who took the placebo, which is not really the vaccine, 90 of them developed COVID-19, which makes it the vaccine efficacy of both the Pfizer and the Moderna virus is close to 95%.
Okay. There are some concerns out there, and we talked about them. You and I have discussed this, and I'll just go down the list. One of them, of course, are side effects. There are some light side effects. However, we did get a report that came out yesterday, or rather this week, about a person who had a severe reaction to side effects, but it wasn't so bad. But there are some concerns about that. What can you explain a little bit about the side effects and what might happen or what could happen after you take it?
Yeah, so for the most part, you can divide the side effects into local reaction and also systemic. And the local reaction is, pain, swelling at the injection site. And the systemic side effects include like axillary lymphadenopathy. In the axillary pit, you can have small lymph nodes, fatigue, headache, myalgia or muscle pain, fever. Those are the systemic complication side effect profiles of these vaccines. And, the Pfizer vaccine, in addition to the ones I mentioned, sometimes it can lead to anaphylactic shock, but that is in a very small number of subjects, so not really in a large number of subjects. So if people have tendency to be allergic to different things, I think it is better to take the vaccine in a healthcare institution so that they can really help them in the event that they develop the reaction, the anaphylactic shock or anaphylactic reaction. But if they really strongly believe they have, the hypersensitivity reaction, it's better to take the Moderna vaccine instead of the Pfizer one, because the Moderna vaccine doesn't have the same kind of anaphylactic reaction as the Pfizer one. I'm not trying to say that the Pfizer one is better than the Moderna one, but I'm saying depending on how people feel about their hypersensitivity to allergies and so forth, if they have a strong evidence that they have hypersensitivity, I would advise them to go to a healthcare system to take the vaccine, or to take the Moderna vaccine. Sometimes it's difficult to have a choice, but if they explain that they have severe allergic reaction in the past by taking other medications, the physicians can understand and shift them to the Moderna vaccine.
And I didn't know that there was a choice there. I know that there are two different companies that are making the vaccine, but I didn't know what you just said is that there could be a different outcome when it comes to side effects. It's very good to know. One of the other concerns also is that the vaccine was approved too quickly. And we understand why, because the COVID-19 pandemic has killed 300,000 people here in the United States and millions around the world. What would you say to someone who says, hey, this vaccine might not be safe for me because there hasn't been enough research on it. There hasn't been a thorough look over as to how this vaccine is going to work out. What's your reaction to that?
My reaction is actually the technology is very different than the vaccines that we have been using before. And as the virus has a lot of mechanisms where it can hide a lot of its characteristics, and our body can actually misfire or send the wrong immune response to the virus. And as a result of that, a lot of people develop severe COVID-19 disease because of cytokine storm reactions in the past. But because the vaccine doesn't really have the whole virus, but the messenger RNA for the spike proteins, the misfire of the immune system is less likely to happen by getting the vaccine. So that's a big advantage in vaccine development and vaccine technology. Yeah, the vaccine, when you have, a disease that is killing people like it does in this country and all over the world, it's a good thing to have a vaccine quickly. I would imagine that normally a lot of vaccine took a lot of time to be developed and also to monitor their side effects and everything over a longer period of time. But this is a particularly different disease which is killing a lot of people. The follow-up period, for the most part, for the Pfizer vaccine is about 2 months, 14 weeks actually, more than 2 months, about 3 months. Mm-hmm. And the Moderna vaccine is more than 2 months. And within this period of time, we're talking about 40,000 people participated in the Pfizer and 30,000 people in the Moderna vaccine. If there is a significant reaction, we would have noticed those things within such a period of time. The other thing is, vaccine development and other drugs, once they are out into the market, the research continues doing post-marketing surveillance studies. But my feeling is, from the safety profile that we see in the data, which has been reported clearly from both companies to FDA, there is nothing to really be concerned about side effect profile, because most of the side effects are really minor. And I think people can be afraid of new things all the time, but there is no indication here, at least from the data that we have, there is severe kind of side effect that's appearing among any of the patients that participated in these trials.
Okay. And then, of course, I also wanted to ask you about the concern over pregnant women taking the vaccine. And I know that children under the age of 16 or 17, I'm not too sure, are not able to take it. What's going on with that? Are pregnant women able to take the vaccine? And if not now, when do you think they will be able to?
Yeah,
and children as well. When will they be able to take it?
Yeah. Children and the pregnant women are not included in these trials. And the recommendation now by FDA is for adults, and it's very clear. Both the Pfizer and the Moderna vaccines are effective in the age group 18 to 65, 65 and older, 75 older. The efficacy is above 93% in all age groups. And if you look at by race ethnicity also, among African Americans, Hispanics, and people with comorbidities, the efficacy rate is above 95%. And in these studies, 9.2% of the participants are African Americans, and about 28% are Latinx. So clearly, patients from different ethnic groups, different age groups, and patients with different comorbidities are involved in these trials. And clearly, in all of these individuals, the vaccine is showing to be very effective. And the subgroup analysis by age, by race, ethnicity, by comorbidity type, all of them show efficacy above 93-94% in all the subgroup analysis. So it is effective. On the other hand, I will say that there are two things. In children, children are not included in these studies, so the data cannot be really moved to children. So there is no recommendation at this time that children should take these vaccines. Pregnant women, the same thing. Pregnant women are excluded from the trial. So at this time, the vaccine is not recommended for pregnant women. And, the third thing I would like to say is in terms of older age groups, like 65 and above, 75 and above, clearly it's very effective. The other thing which we don't know is among subjects who have, cancer or immunocompromising diseases, we don't know how robust will be the immune response following these vaccines. Those people are not also very well studied. So we have to wait to get more data on this on this type of individuals in children, pregnant women, in patients with immune compromised diseases like cancer, HIV, and other things.
Okay. You and I talked this week about the conversation that's going on in the African American community. A lot of African Americans are reluctant to take the vaccine because of the medical history in this country when it comes to African Americans and medicine. We had a very good conversation this week about that, and I want you to tell us what your thoughts are on. A lot of our folks in the Black community are saying they're not going to take it because of a lack of trust with the medical community. What are your thoughts on that, and what's your message to the Black community?
Yeah, we have a very bad history in this country because of the Tuskegee, the Tuskegee study, where a lot of African Americans are actually involved in the syphilis study, just, to examine and understand the natural history of syphilis without giving them medication. That's a very painful experience for all of us. But I would say that, we are at a very different time now. A lot of the studies that are done under the Helsinki International Ethics, and a lot of African American scientists, physicians are also involved in these, studies. In other words, not only as participants but also as investigators also. But 9.2% of African Americans actually participated in the Pfizer study, and about 10% African Americans in the Moderna, and about 28%, as I said before, Latinx in the Pfizer, and about 20% Latina in the Moderna vaccines were participants. So this tells you that African Americans were part of the study. The efficacy among them was clear. The vaccine efficacy was clear. And the side effect profiles that was manifested among African Americans is not that different from the side effect profiles that we observed among the white population. And given that African Americans are always at a disadvantage socioeconomically, politically, and also educationally, in a lot of ways in the society, we are at a disadvantage. And the large number of diseases, African Americans have more diseases, more diseases in every disease. If you take, the top 10 diseases or the top 8 diseases that kill Americans, African Americans have a higher mortality in all of them than whites, be it cancer, be it asthma, cardiovascular diseases, everything. So we always, take the burden of the disease, and the majority of the burden actually is shared by African Americans. And COVID is no different. COVID affected the African American population in a huge way. The mortality is much higher compared to whites. Overall, you can say about 2 times. But when you look at it by age group, actually in some younger age groups, the mortality is about 7 times higher among whites. And because African Americans are always at a disadvantage of getting diseases, and they don't get the appropriate health care on time. And this is a great opportunity for African Americans actually to take this vaccine and prevent the occurrence of COVID in them and in their families. And, if they remember all of the people who died of COVID within the last few months, all of these people will tell them to take this vaccine if they are alive. So my recommendation to all African Americans is, I am an African American, and I will not come out in public and say, African Americans are safe to take these vaccines if it is not safe. I am the one who will fight first if there is something wrong in these vaccines and advocate for African Americans not to take it. So my recommendation is, every African American should go out and take this vaccine and save their life and the lives of their families. That's a very important thing to do.
All right. And I do want to ask you about, we're seeing the vaccine out now. We're seeing on television, on the news, online, on social media, people are taking it. Those frontline workers are taking it. I know that there are folks at Downstate who are taking it as well. But how far away are we from going back to normal? Because that's on a lot of people's minds, because the vaccine is going to be administered in phases. And I think, me, for example, I'm a 37-year-old guy who's, in good health. And I'm going to be one of the last people that's going to get it. But how long will it take until we are back to normal now that the vaccine is here?
Yeah, so one thing that should be clear is these clinical trials, the end point that they are examined is a clinically important COVID-19 infection. So they didn't really examine whether taking the vaccine actually completely prevents the virus staying in people's nostrils. So although it prevents clinically relevant COVID-19 infection, we don't know whether, there will be some viruses in people who took the vaccine in their nostrils and whether they will be able to transmit the virus to other people or not. Those are the things we need to study more. But what I can say is if about 65 to 70% of the population is vaccinated, will reach herd immunity, and the transmission of the virus will be blocked by that time. And in order to reach there, after the healthcare workers are vaccinated and people who live, who are elderly people are vaccinated, then I would say by, around July, a lot of people will be vaccinated. By then, we should have really herd immunity, and the transmission should really cease or decrease significantly. And by the fall, we should be able to get to normal. By saying that, I think we need to continue using masks, and we need to continue social distancing until we reach to the herd immunity, because the infection rate is very high now. And until a lot of people are vaccinated, and until the transmission is significantly stopped in the community, more and more people will be infected in this second wave, and a lot of people are likely to die. So everybody needs to continue using their mask, and they need to keep, 6 feet distance from other people. So those are important things. But by the fall, I have a strong feeling by the fall that a lot of things will go back to normal, and the summer will be a reasonable time for a lot of people to start, going out. But by the fall, we should really return back to normal.
All right. And my last question for you is that, while all of that sounds like good news, we're going to hopefully be back to some type of normalcy by the fall. Right now, COVID-19 cases are rising in New York City, and there are threats of closures after Christmas. I believe the governor Cuomo and Mayor de Blasio have said that is a possibility, that things could close down. Schools are closed right now as well. What do you think is the cause of this increase that we're seeing? Because New York was doing pretty good for a few months, for several months actually, but we're starting to see an increase in cases. What do you think is the cause of it?
Yeah, we do a lot of contact tracing in Downstate, and Downstate is very effective actually in controlling the transmission of the disease among the workers on campus. And our experience is a lot of the infections that we're seeing, the small number of infections that we're seeing, are coming from their families. People, employees and students actually bring it from their small family gatherings. It's not, the transmission is not within the campus, but it is actually within a household that's happening mostly. So people for Thanksgiving, they came together. They didn't probably use masks, and they were together, and they get a lot of the infection from their families, and they are spreading it. And my fear is the same thing will happen for Christmas. A lot of people will come together, and the disease will be spreading significantly if people don't take precautions. And one of the things they can do is, as much as possible, it is better to avoid, coming together in the same household. It is okay for this. The light at the end of the tunnel is there, so it is better to be safe this holiday season. In next holiday season is another one to celebrate. But if we die, what is the point of celebrating it? So if people can avoid coming together for this holiday, that will really help a lot. And if they come together, it's better to be in a very small group, and within families also. When they eat, if people eat separately in different tables, maintaining 6 feet apart, and otherwise, when they are not eating, if they use masks, even within the house, it will help. And as much as possible, whether allowing, if they can have interactions outside and eat outside, that will also cut the transmission of the virus. So the main reason is people are, gathering in the households, in families, are coming together. That is the source of the increased infection as a result of Thanksgiving. And that is going to continue for the Christmas and the New Year period. So I think people need to be very careful during this holiday season.
All right, and with that, we will conclude. Well, listen, thank you so much, Dr. Demissie, for giving us your insight. We really appreciate it. Thank you again.
Thank you, Josh. I really appreciate for giving me this opportunity. Thank you.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.